How do you fix your sleep schedule in case you're working a night shift or something of that sort?
So before going to the shift work, let's talk a little bit about the chronic insomnia treatment too. For this patient especially, I think if it's chronic insomnia not related to shift work, I would definitely consider better sleep hygiene. The sleep hygiene typically is the first treatment to go to. Then you basically talk about medications if there are significant symptoms associated with poor sleep pattern at night. Then you're falling or having poor memory issues. Maybe short-term medications, pharmacotherapy is okay. But along with the sleep hygiene, or what we call as cognitive behavioral therapy of insomnia, which includes several things, including the sleep hygiene. Sleep hygiene is typically, I don't know uh, how much people do in this day and age, so much of difficulty with the cell phones and everything. But sleep hygiene typically entails having a set schedule at night to sleep and set schedule to wake up. So I think sleep wake cycle is better regulated that way. Minimizing the naps and taking the naps early on before 3 p.m. So take the naps. If you take naps, take the nap only for half an hour. Longer naps, more than 1 hour, actually have shown to kill people more. So less survival long term. So it's better to take, if you take a nap, take less than 1 hour.
Mhm.
And then basically keep the sleep, to sleep well at night. I think you need to keep the bedroom very cool and dark. Actually, a lot of people say keep the bedroom only for sleep and sex. So basically, don't do anything else. So you don't look at screens, and basically bright screens, the LEDs cause a lot of brightness, and especially the blue light cause one of the inhibition of one of the hormones called melatonin causes the opposite of sleep. So basically, you don't want to stimulate your brain middle of the night by looking at screens. And then obviously the not looking at the clock to see what time it is, and worrying too much about lack of sleep. And don't go to bed if you're not kind of sleepy. So get out and basically do something else, and then come back to bed only when you are sleepy. So listening to soothing music, warm showers, exercising before 3 p.m., avoiding all the stimulating stuff like caffeines and nicotines, basically what excites you. The caffeine actually after 3 p.m. can last until 10 p.m. So don't want to drink a caffeinated drink after 3 p.m. Not a good idea. Most of us drink chai or tea at 6 o'clock, so it's not good. Uh, so early on is better if you have sleep issues, especially. So I think so. There's the cognitive behavior therapy is important because it's kind of includes the sleep hygiene, but also does a lot of it has other components which does help sleep better. So coming back to your questions, shift work. So complicated again in this modern world and industrialized world and globalization. A lot of people working at night when we are here daytime in US. So it's a big issue, and that's no easy answer. The shift work, again, the best thing is to, if you are working, let's say 9 to 7 or 10 to 7, the thing you want to do is set the sleep schedule, still strictly follow a sleep schedule. So in the morning you go home, basically if you start taking a nap or basically taking your sleep 9 o'clock to 2 o'clock, keep that same schedule, and not exposed to bright light in the morning. So basically the bright light always stimulates awakening. So you don't want to expose yourself to bright light when you're back home. And take a good sleep, maintain a good sleep schedule. But after your sleep, basically try to not go back to naps, and kind of fragmented sleep wake cycle is never good. And then there are certain medications we can use. So melatonin is one of the things we commonly use with sleep wake as shift work people. And also there are stimulants we use before the shift so that they don't fall asleep during the shift. So there's both of them. If they are done well, you could actually manage them while they're working. And again, I think if you're coming to medications, they need to consult a sleep physician it's better that way because these medications can have a lot of side effects.
Mhm. Thank you so much, doctor. I, for one, did not know that my post-class naps were killing me. So I'm gonna take care of that now.